Now, as we enter peak flu season in the midst of this pandemic, hospitals are bracing for a busy winter. Dan Grossman found how healthcare professionals are preparing.
Like even the most knowledgeable of researchers,
we're anxiously awaiting to see what happens as this continues to unfold.
Dr. Michelle Barron doesn't have every answer as we enter our worst stretch of this pandemic.
How much is this going to play into things, and is it just going to make everything worse? Will it commingle with COVID and actually make people double sick or doubly ill?
COVID-19 is coinciding with flu season, a potentially dangerous scenario Dr. Barron has given much thought to as the Senior Medical Director of Infection Prevention and Control at one of Colorado's largest hospitals.
We've also been really encouraging patients to get their flu shots and make sure that they have that on their list. And we tell them, we understand there's some years that you're sort of debating whether or not it's worth it. And we're like, this is the year you need to get it.
The CDC estimates around 196 million flu shots are available this year, a 13% increase from last year's record-setting dosage of 175 million.
Flu shot immunizations are up 41%. So I think that messaging has been definitely taken hold.
It's an important number, as last year 400,000 people were hospitalized for the flu, a potential burden hospitals have prepared for as bed space is now at a premium.
We've already surpassed the numbers from the first surge. So we're kind of like, okay, what's next?
Maddie Smith works in this COVID ICU in the University of Colorado's hospital. They shot this video for us and say while they haven't reached a tipping point, they are expecting more flu patients to come in as the winter months arrive. To manage, they've made plans to allocate more bed space to the seriously ill, regardless of cause, and treat them with whatever drugs are necessary. The good news, the flu has been treated for years, so doctors have a good plan of attack. And the measures we've taken to reduce the spread of COVID are having a positive effect on the spread of the flu.
We usually are able to use the Southern Hemisphere as a good way to figure out how our flu season is going to look like. They actually had a pretty mild flu season, but COVID hit at the exact same time.
Dr. Barron says 3 to 5% of COVID patients have had co-infection with another virus, showing complications are possible as flu season hits its stride, but not guaranteed.
I don't think it's anything that we can't manage that we haven't already thought about.
I'm Dan Grossman.